Dr. Shannon Clark here. I am listening to season 23 of Something Goes Wrong podcast, where they discuss the Origins Birth and Wellness Center out of Dallas, Texas, and specifically related to certain patient experiences and then ultimately what happened. And episode 1 is with Kristen. And she talks about how at 22 weeks, she started to feel like she had bacterial vaginosis. So she reached out to the midwives in her group at the Origins Birth and Wellness Center, and they recommended that she used garlic clove suppositories to cure this infection. So she questioned that because she knew that it is treated with antibiotics, and she asked to be seen by a nurse practitioner. But instead, they had her come in to do her own self-swabs to see if she really had BV. But every time she did the self-swab, which you can potentially do a self-swab to screen, to get to send off for testing for yeast or BV, but the swabs would come back with no read. So that wasn't working for her. So finally, she just went to the nurse practitioner to get treatment for BV, proper treatment. So let's talk about BV in pregnancy. So when pregnant patients have symptomatic BV, meaning they come in complaining of symptoms, there are some patients who have BV who don't have symptoms, but if they're complaining of symptoms, they need to have treatment with antibiotics in the form of metronidazole, which is Flagyl, or clindamycin. And treatment with these oral antibiotics has not been linked to any adverse pregnancy or fetal outcomes. But untreated BV has. Untreated symptomatic BV has been associated with preterm delivery, early pregnancy loss, and postpartum endometritis, or a postpartum intrauterine infection. And garlic does not treat bacterial vaginosis. It just doesn't. So, if anyone tells you to go home and put a garlic clove in your nether regions to treat your BV, huge red flag. Where's the red flag guy?